let's talk about the problem that you're trying to solve. So it's a data management problem. And it's when you were describing that feeling that you got with this excellent technology, but it's not quite there. It's such a strong emotion for me because I get that so often with so much tech. You go, this is supposed to be so good, but there's just something missing. It infuriates me. And you almost want to say, well, I just want a freaking card system because it's not going to crash. It's not going to hang. Back. It's not going to, because it actually worked better. Yeah. It actually caused me less stress. So, because technology is amazing, but when it's not working, it's freaking stressful.
It's not working for sure. Yeah. Or the promises that were given, the way something is going to work and it doesn't. So yeah, the problem that we're solving is all around veterinary medical data. And it's interesting because everybody knows how bad it is. They all say a bunch of things and everybody I think here will agree. It's just that nobody has time to really sit down and assess it. Nobody has time to acknowledge it. And instead, with the way that the veterinary world is, nurses and vets and receptionists and, admin people, we're so busy that we don't have time to go, I wonder if there's a better way. I wonder if we can do something. It's like, no.
I wasn't going to disagree with you. Could you say veterinary data, everybody knows it's so bad. And I want to disagree and go, I don't know that we do because you're used to it being this way and that's the way it is.
Used to it.
So why, give me examples. Okay, so you've given the example of a radiologist who gets reports. That's not most of us. So in everyday veterinary life, why is it bad? What's bad or what could it look like?
Yeah, sure. So, we'll go through some examples. In an emergency clinic, the animal arrives. It's a 6-year-old dog, and you have no information whatsoever on that animal except from what you can get from the frantic owner.
Which is always amazing. It is amazing. Is it on any medications? Yeah. Yes, it's some tablets for. I think it's pink. I think it's for his incontinence, but maybe it's for his heart. Okay, that helps. That helps a lot.
And, these animals were seen by their vet 2 hours before that. They had blood tests, they had everything, but it's just not available. And even if it is available, say that they do have access to the history or it's printed out or maybe they have it, it's full of mistakes as well. Because we are human and we're typing in information and we're typing it in with errors. When we look at a practice and the medical data, 60% of the medical records have mistakes, even in what the patient identifiers. So if the husband brings in a cat in, say, March, the wife brings it in April, there's 2 different records for the animal because it came in with 2 different people. And now we have this splitting of medical data.
Probably spelled differently.
Yep. Or they put in the microchip one year and they forgot one of those zeros. We have a story of the husband brings it in for vaccination in March. The wife brings it in August, and the vet goes, this cat hasn't been vaccinated in 4 years. And she's like, I tell the bloody husband every time he goes to the vet clinic, every time, and he always forgets. The poor cat's been vaccinated 8 times in 2 years, right? So, and he's doing his job, but he can't remember. He's like, I swear to God, they got vaccinated. So it's just stuff like that. Or you look at how many times you're filling out forms or calling hospitals for hey, we've just got Fluffy here that's moved from, I don't know, Adelaide. Can you send the history? They're busy because they've got a normal job to do. It's just when you think about what you're asking for and what is available are 2 different things, but we don't have time to think about it. It's the status quo of this it's an archaic way. We have lots of different software that doesn't talk. And if it does, it doesn't map very well. I think if you look back and say, we should probably redesign this better, that's sort of the approach I took. And I thought, I didn't think it was going to be easy or simple, but it's definitely a better way to do this. And that's sort of where we've come to with what we created with Vedi and obviously what we're solving. So to boil it down very simply, we figured out a way to lock the patient's medical data to its existing microchip. So the microchip that's always there. American listeners might, they deal with microchips all the time, but it's just not as prevalent in the US. But in the UK and most of Europe and Australia, it's a mandatory requirement for cats and dogs to have a microchip. So we thought if we could tie all the medical data to that microchip, wherever that animal goes, scanning that microchip would open up access to this information. But we're kind of left with another problem there. It's like, cool, you could put a million different pieces of information in there that it doesn't really matter to the end user unless they can trust implicitly that that information is correct. Because if it's wrong and full of these mistakes and these duplicates and the wrong patient got the wrong blood results, then they're left at the start again and they have to repeat everything. And now they've gone through all this process and it's not been helpful. So the other part of what we do is make sure that every piece of data getting associated to that microchip and locked to that patient is not only true and accurate, but verifiable by the person downstream. And what I mean by that is that the person that's dealing with that information when they scan that microchip can see exactly when that data was made by who, and allows them the confidence to move on. So the example of that would be the Hendra virus in Australia. So I'm sure most listeners know about Hendra virus, especially you where you are. It is a viral disease that goes from bats to horses, and then humans can catch it from horses.
And can die.
Yeah, so 50% mortality rate, right? So when we're talking about trust and integrity in vaccine certificates, nothing's more important than a 50% mortality rate. Now, right now, before us, the way that the vets would certify this is that they would write down that microchip number, and because they're human, there's mistakes. That would go onto a registry, and sometimes it's CSV uploads of horses from a paddock. Nobody knows that 2 horses left 3 days ago and they weren't vaccinated, and 2 more came during that time, but they haven't been updated on the list. But the registry says that they're vaccinated. And so I think for something that's got such a massive biosecurity and zoonotic risk, that's not a great state. And that's just the far extreme. So we came in and said, hey, the vet scanned this microchip, and we have absolute proof that it was done here in the hinterland of the Gold Coast at this time, at this place, and this microchip scan. But they also scanned the vaccine vial, and there's a GPS location with that image and a time-stamped event with the cert that the vet has done on their device at that time location. And then we also use nerdy tech, and I don't want to get too nerdy because it is, but we also use a blockchain timestamp. And what that does is it says that this information in terms of this horse was here at this time with this vaccine vial and this vet, it gets packaged up and locked at that time. So when somebody else 2 years later or 1 year later scans that microchip, they know with absolute mathematical certainty that their friend, the vet, was there 2 years ago vaccinating that animal. And so, we've got images of grotty thumbnails holding a Hendra vaccine with a GPS location. And so it just provides automated certainty of an event happening. And none of that required somebody to enter a microchip number or write so on a piece of paper. All they had to do is scan the microchip and scan the vaccine vial. We did the rest. That means that now we have oversight into a vaccinated population, or we can see which batch numbers are going to which animals. There's so much more that's activated when you have clean, verifiable, automated data. It almost changes the world. And that's sort of the thought process behind what we're doing. And I don't want to get too into the woods about that, but we apply that to everything else we do in the small animal clinic. We'll save the vet's time because it's removing the human entry and the errors associated with that. But we're giving the downstream vets or owners something that they don't need to question. It automatically plugs into their system. So I guess clinical pathology is another one. The vets scan the microchip and they scan a blood tube with a barcode on it. We marry the two. All they have to do is choose the test. And now there's traceability of that blood tube to the lab. It's compatible with the sushi trains of analyzers at the lab. When the results come back, we timestamp those. So it's just like everything's automated, and we know everything about that animal from a scan of a microchip. Who owns the animal, what sort of breed, age, everything there. We know the vet that it came from. We're not going to ask them to fill out a form. We know all that information on the form. So we just say, hey, what test do you want to do? And give us some history if you want. But now we're going to track this sample, which belongs to this exact animal. And the lab has all the data they need. And then the results come back. We lock that to the microchip as well, so that if that animal goes to the emergency center at 3 a.m, scanning that microchip will show the last blood results or the last 10. And all of it was done instantly without all this data entry.
That hits me at a good spot there. Like, it makes me very happy, because that, what you say there, we already have all that data. I often, especially with us, with human stuff, with government things or tax or hospitals or things like that, and you fill in the same information every time.
God, yeah.
And I'm like, but you already know this. I guarantee you that if I commit a crime, you're going to find that information in about 3 seconds. But now you put the onus on me to provide it again and again and again. So this basically says, yeah, we know that. We know these things about you, and everything new we learn about you, we're going to keep it in one place, so that next time somebody wants to know it, they can scan your microchip and go, yep, here's what we know. Let me add some more data to it.
And there's an aspect there is like, we're not just passing this information out willy-nilly. We're basically saying, prove to us that you're a vet. And when you scan this information, the previous vets want you to have this. So, we're not saying go to the dog park and scan all these dogs and get their owner's details and give them 50% off. Like, no, they have to, one, prove that they are the attending vet and the vet that manages that owner. But at the same time, we're going to tell anybody, hey, this animal is vaccinated for rabies or canine influenza or Hendra. Like, that's information that every vet wants every other vet to know, or any animal health worker. So that's, and going back to your question about, like, do the vets know this? I think the vets know the problem, because exactly right. Like, they are frustrated writing out something again that they know is saved on their practice software, and like, if you think about it, it's like, yeah, sure. Like, there's some amazing practice software out there. They handle a lot of things, but the service providers still want you to fill out a form. They still want you to, and the reason they do that is that the service providers can't trust the data that comes from the practice software. It's full of mistakes. They don't know when it is a mistake or not. So they say, what, screw that. Let the vet fill it out again properly. And that way we can ignore the burden of data integrity back on the vet before they submit this form. Otherwise, it would just be chaos. So we kind of found that perfect balance there of, we know everything about this animal, this vet, and this owner from the start. Let's not ask the vet for the same questions again. Let's just plug them into the next service that wants to use that provable, verifiable data. And it's like, it almost, in hindsight, a lot of people saying, this is why wasn't this done at the start? And, practice software in the vet world, practice software became both the health record and the billing and the scheduling and the appointments and the stock and everything. And now they're starting to realize that animal goes between different services all the time. Either its data does, or it actually visits a referral, an emergency, the GP hospital down south on holiday, or it moves to Adelaide. Like, the health
Kennels.
record truly does. Kennels, yep. There's a lot of people that need to see that health data, but the practice software
holds on to it,
locks it up in just that service. And they're not doing this maliciously. It's just they offered a service of how to do clinical notes. But what we're offering is a universal health record that allows that to go with the animal and go with where the vets want that data to go. That's where we come in. We're not becoming a practice software at all. We're just becoming that health record that's going to bridge between all of them.
One thing I just need to point out, and I know this, and that's why I think it's important to mention. So it's not like you have some magical special microchip that receives all the information and stores the information on the microchip, right? It's your normal everyday microchip.
No, it definitely wouldn't work if we had to reintroduce a new microchip. So no, it's the existing microchips that are there. And what we do here is that we use it as a lock and key. If that animal is there and the vet scans it, proving to us that the animal is there, like, they can't type this number in, they have to scan it. That unlocks the world of which that animal's data is stored. I guess the way to explain this, they've unlocked access to that animal's data that might be stored in the cloud. And they've done so by scanning that microchip. And then obviously the ability to add information to it gets locked again when the animal leaves. And just having that time-stamped verification, they can say, whoa, I can see exactly when that PDF was made. So think about the rabies certificates in the UK or in Australia. Right now, you have a vet that nobody knows doing a vaccine certificate for rabies, and they scribble their signature and when it's due next and put that sticker that's already smudging on the card. And they say to the owner, keep this with the dog. And we've got the microchip sticker in there too, so they'll look at that. Then it goes to like sort of a district government vet who gives it a stamp of approval. And then it goes to the exporting vet and maybe the logistics vet, big stamp, checking the documents. And then it arrives on the doorstep into Australia or the UK. And that's the first time that they know about this happening. And they have to trust the integrity of the first vet and the district vets that they've signed and checked all these details that it's actually happened. What we're saying is that let's put the importing authority or the people that need to see that this animal is vaccinated, let's put them into the consult room at the start. We're going to show them the image that was used, the proof of the microchip scan. So we know the animal was there, and we know the vet that was there because they're using the app to scan all this information. And we time-stamped it so that this couldn't occur at any other time. And we're showing the certificate as a digital timestamp as well, so that when they see it, when it arrives in Australia and the UK, they know that it's not a forged document. It's true and verifiable back to that date.
I just want to encapsulate it one more time, just to make sure I understand what this does. So tell me if this picture that I've got in my head. So all the patient data. You said data or data?
I go data, but I've got the Canadian accent, so I prefer data.
Did you say Vedi or Vedi?
It's Vedi, but it started in terms of its name idea came from sort of the Jedi, the Force being everywhere. I thought Vedi, but everybody sort of changed it to Vedi because it sounded more medi.
I like Vedi. I love that, the Force. So basically the data is in the Force, in the ether, in the cloud. It's there available at access points where anybody might want access to that patient's data. So that's at the vet clinic, at the emergency clinic, at the kennels, at the state vet that needs to verify anything. But I can't get it until the key comes into physical proximity to me, and the key lives under the skin of that animal in the form of a 16-digit code. And the animal comes and it says, scan it with your magical scanner. Now the door's open and I can see what's there and I can add to it. And then we're done, the door's shut. And is that right?
That's almost 100%. I'd say that there's still aspects of the animal's data that will travel without the animal. So like medical images will go without the animal and, results and certificates. But that's the premise, is that to be able to access and add and interact with this high quality medical record, you have to prove the animal's there. And that affords all these automations. Yeah. And obviously we're not complete with the medical history yet. We're building strategically and logically. Like we started with the vaccination certificate because that was the point of entry that we thought we could deliver. And we looked at insurance claim forms or council registrations, but there's a 53% chance that the animal walks into that GP clinic for vaccination, or vaccination is going to be done during that consult. And the owners were leaving with a paper certificate that, by the time they walked out the door, they've lost it. And then they're calling at Christmas saying, hey, can I have a certificate? I'm going to the kennels. And so we just said, let's lock that to the microchip. If it goes to the kennels, they can scan the microchip and see it. And we solved something instantly for the owner. And we also solved something for the front of house staff, the receptionist. We've solved it for the vet. And we had to say, all right, so they like it. Let's just make sure that this is super instant. So the vets, all they have to do is scan the vaccine vial and we'll pull everything else up. That was the first step. And once we were in with vaccinations, and that was a paperless version of this, we still have email certificates, but still this is far more valuable and stays with the animal for life. But very quickly, we had to build upon this. And so the next logical place for us to go was clinical pathology with reference labs. And so we built that system, and now we're on to our fourth or fifth system that's in development now. So we're, emergency check-in and access and referral triaging. So, the vet wants to send this for a referral. Instead of filling out web forms for 5 different referral hospitals, we can automate all that, right? So we have an end-of-life module, which works with a crematorium here. So we have the largest death registry. I mean, how many times has a receptionist fielded a phone call from an owner that said, you've sent me a vaccine reminder for my animal that you put to sleep last week. And it's like, oh my God, I'm so sorry. It's horrible, but it happens. And it happens because information is not being available or being used properly. And it's a tedious process to keep on top of this. So if we see that animal is deceased, we will broadcast that out to all the clinics that have scanned it before, saying, hey, Mrs. Johnson's just lost her dog. Don't send her a vaccine reminder, set her up as a deceased animal. That's the sort of aim we're going in. We're building upon that all the time.